Welcome back for one last recorded lecture in our auditory verbal practice course. In the last few weeks, you've been presented with a wealth of information in a relatively short amount of time. We're going to take just a few minutes to walk through some key concepts and remind you of all that you have learned. Module 1 was cochlear implant evaluation, candidacy, assessment, and surgery. You were introduced to mission probable, the idea that with early and accurate identification of hearing loss, normal speech and language is probable for children. But this mission takes a team. It takes the child, their family, the surgeon, audiologist, listening spoken language therapist, and others to get to great outcomes. When to refer for a cochlear implant evaluation was also discussed. Key times being when a moderate to profound sensory neural hearing loss is present, if there's a profound ear and a moderate to severe ear, when there's a diagnosis of auditory neuropathy, especially if it's accompanied by speech and language delays, when there's a diagnosis of enlarged vestibular aqueduct that may signify a progressive hearing loss, when there are moderate speech and language delays due to hearing loss, and if in general a child is not making adequate progress with amplification that allows him or her to keep up academically and socially with their peers. In Module 2, I talked to you about auditory function. That's the brain's ability to interpret sound meaningfully. And it fits as a key piece of the auditory verbal approach. This approach is an early intervention approach grounded in 10 guiding principles. It's an approach that takes advantage of neuroplasticity in the first few years of life, today's technology, and the power of the parents. While remembering, it's all about the brain and the development of a brain to interpret sound meaningfully. In Module 3, Sarah Newman took us through cochlear implant programming, helping us understand that all parties need to understand programming, at least to some degree, in order to reach a successful outcome, and that it's collaboration between different professionals and the family, and talking about concerns with one another that leads to the best outcome. And that programming is a marathon, not a sprint, especially early on as you work to optimize what the child is hearing. In Module 4, Sylvia Rotfleisch talked to us about speech acoustics and showed us how to do speech error analysis so that we can understand which sounds a child may not be hearing, which frequencies may need some help. She had talked to us about the importance of low frequency information as a key piece of getting intelligible speech. And she reminded us of Dan Ling's words that audition is the only sense capable of appreciating all aspects of speech. In Module 5, Dr. Teresa Caraway talked to us about auditory teaching strategies and showed us all the ways that we can help facilitate success for parents working with their child. She continued in Module 6, showing us how to coach parents and helping us understand the importance of 5 essential steps in an auditory verbal session. That it starts with a greeting, that you set the stage so that everyone knows what to expect. And then you spend time learning and practicing, after which you reflect and talk about what happens. Then evaluating how the session worked and how the child progressed so that we can get great listening and spoken language outcomes. In Module 7, Lindsay Zonbeck talked to us about special populations and reminded us that listening and language are still acquired in the typical developmental sequence, and that the same listening and spoken language strategies and techniques apply in these different populations, such as the presence of a bilingual home, auditory neuropathy spectrum disorder, children with comorbid conditions, and children who receive cochlear implants at an age older than we'd like. She also talked to us about those children whose comorbid conditions may make for the same receptive language, but a different expressive language outcome, requiring the use of augmentative and alternative communication. Lindsay then took us to adult oral rehab, showing us that in adults, the auditory skill development follows the same sequence as it does with the children, but that it may progress faster when an adult is relearning a skill they've already had in the past. She also showed us that the auditory strategies and techniques are the same that we use with children, and they work very well with adults. She gave us some considerations, though, for working with the adult population, and those included the impact that cognitive decline can have, the consideration that needs to be given to the person's physical abilities when handling small processors and needing to use technology. She also alerted us that many adults, older adults, live alone and they're not comfortable with technology, and they may need help with practice and finding ways to practice, and that they're impacted by the little conversation that occurs in their day-to-day lives. In modules 9 and 10, Darcy Stowe guided us through therapy sessions with Noah and Jackson to show us how to apply the things that we've been talking about in real time with real children. We hope that you've enjoyed this course and that you'll join us in promoting excellent care in cochlear implants, and that you'll seek Hearing First Out for continued learning opportunities and enable us to power the potential of young children towards excellent outcomes. And remember that the AG Bell Academy is the organization that monitors certification and that ensures children who are deaf or hard of hearing and their families have access to highly qualified professionals. Thanks so much, and we look forward to seeing you in the live lecture.